How do I prepare for psychological debriefing? Have you ever wondered how to get ready for psychological debriefing after a traumatic event? This structured process aims to provide emotional support and help individuals process their experiences. It typically takes place within 24 to 72 hours after the trauma and lasts between 1 and 3 hours. Understanding the purpose and format of psychological debriefing can help you feel more at ease. This session is often conducted in a group setting by trained facilitators, including mental health professionals and peer support workers. The goal is to allow participants to discuss their feelings, validate their reactions, and learn about coping strategies. Knowing what to expect can help set realistic expectations for the session. It is essential to recognize that psychological debriefing is not a therapy session. Unlike cognitive behavioral therapy, which focuses on long-term treatment, debriefing is a single session aimed at providing immediate emotional support. If you feel you need more extensive help afterward, be prepared to seek additional professional support. When preparing for the session, be open to sharing your thoughts and feelings, but remember that participation is voluntary. You should only share what feels safe and comfortable for you. There is no pressure to disclose more than you want. Emotional responses are a normal part of discussing traumatic events. It is helpful to acknowledge that you may feel upset, anxious, or overwhelmed during or after the session. Planning for self-care afterward can be beneficial. Consider resting, engaging in calming activities, or reaching out to trusted friends or family for support. It is also important to know that psychological debriefing is not a guaranteed prevention method for post-traumatic stress disorder. Scientific reviews have found no clear evidence that it prevents PTSD, and some studies suggest it might interfere with natural recovery. Therefore, view debriefing as one possible early support rather than a definitive solution. If symptoms persist or worsen, seeking professional evaluation and evidence-based treatments, like trauma-focused cognitive behavioral therapy, may be necessary. Finally, ask about follow-up resources during the session. Facilitators often provide information about additional support services or screening for those who may need further intervention. Being proactive in asking about these resources can help ensure ongoing care if needed. In summary, preparing for psychological debriefing involves understanding its purpose, setting realistic expectations, being ready to share within your comfort level, and planning for emotional aftercare. Given the lack of evidence for its effectiveness in preventing PTSD, psychological debriefing should be seen as part of a broader approach to trauma recovery, with attention to follow-up care and professional treatment as appropriate.